Hello, welcome back to the channel and thank you for tuning in again. Yes, I had to take a break to recharge my battery, so it's good to be back with you. Today's video tells the story of a physician assistant based at a rural clinic in the Ashanti region of Ghana. It tells of his tenacity, his passion, and his drive to provide the best of care to the inhabitants of the village. I first came into contact with this gentleman in May 2013 when we were working on a community library in the village. And since then, I have witnessed how, under his leadership, the clinic has seen so many improvements. And of course, in collaboration with African Diaspora Healthcare professionals who are based in the UK. Let's listen to his story.
My first experience to St. Thomas General and Maternity Clinic wasn't a pleasant one. I came to meet only one staff at the facility way back in 2012, who was even a health assistant. Transferring to a new environment to work with only one staff I wasn't happy at all. And then also accommodation wise, there were no staff quarters for the facility, and then so I have to even roam about the whole community to find accommodation. And then also when it comes to the transport system, sometimes you have to find the bus, the best bus. You have to be on top of the bus before you be able to travel to the nearest city, which is Obuasi. And then also there wasn't any light at the community by then. So in fact, it was very, very, very unpleasant experience. My initial impression about St. Thomas General and Maternity Clinic was I thought I was coming to an environment where at least maybe the basic medical equipment to work with are available. But in fact, when I got here, it was nothing to write home about. There were no medical equipment, staff too. There was only one health assistant at the facility by then 12 years ago. So in fact, it wasn't pleasant at all, and I didn't even know where to even start from. The environment wasn't safe and ready for work to begin. When I started to work at St. Thomas General Maternity Clinic, I had a lot of ideas in mind. First of all, I decided to communicate with appropriate bodies to get more staff to improve the work to be able to achieve the goal. And then secondly, we also decided to increase the OPD attendance. Initially, sometimes it comes to a day that you only see one client in a day. So I decided to also embark on other activities such as home visiting and then outreach services to improve the OPD attendance. And then I also decided to get national health insurance application for the facility. Since when I came, there wasn't anything like that. I also had a plan to upgrade the facility into the next healthcare system. The acquisition of nurses, midwives, and other clinical staff will be able to apply for upgrade into the next level. And also to lobby to get some medical equipment to work with. I met my donors way back 2013. By then they were embarking on a project at the community where the facility is being located. So it was one teacher who recommended them to me, and then we got their contact, started communicating. And then from then they have been very, very, very supportive to the facility and then the community as a whole. We keep on communicating day in and day out to assess the facility by the progress of how things are going, and then they support us when the need arises. It was the first time of doing Zoom meetings, so in fact exposed the facility, not me alone, but St. Thomas General Maternity Clinic had the opportunity to be served to the whole world. In fact, coming in contact with our donor and other partners has been very, very helpful to St. Thomas General and Maternity Clinic, since we have received a number of benefits. We start with fetal Doppler. In fact, through our donor partners, they supplied us with fetal Dopplers and other medical equipment such as autoclave, pulse oximeters, stethoscope, thermometers, gun thermometers, and a lot. In fact, they have helped to render quality health services to the Appiah community and then the surrounding ones. Then I'll also talk about the power. When I came here, there were solar at the facility, but it wasn't functioning well. So through our donor partners, they maintain it. There was they gave us a form of maintenance, which currently, as we are speaking, we have solar power at the facility 24/7. And then they have also supplied us with hospital beds and then bedside lockers, which we are currently using them now in our new building. So that has been very, 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 very helpful. And then also, in fact, we're not having any lab, but through our donor partners, they've been able to help us to put up a modern lab too. And then they've also supplied us with other equipment such as microscope and other basic equipment, which they are all in use now. And then it has really improved the healthcare delivery system in the facility. So what I'll say is that God richly bless all our donors for supporting us. I would like to take this opportunity to thank African Diaspora for their immense support to St. Thomas General and Maternity Clinic. Not to us alone, but to the whole African community, especially the rural communities.